Dear Chairman, dear ladies and gentlemen, let me say thanks for Mr. Tomasz Tyrch for his invitation and possibility to be here on a big Congress CICOT in Prague. Now, doctors who use external fixation don't think about story from what everything beginning. And when we start femur elongation, we will not think about many techniques which Professor Ilizarov recommend on the elongation with patient with achondroplasia. I want to tell you a little bit story, a little bit words about history. On 1660, Glissant first time write down about achondroplasia. Then Perot, Marie, Kaufman, Volkov, Ilizarov, Caton, Paley give us new important information about this disease. And always this short people has big dream to be taller. And nobody in the world can give real support for this poor person. And Ilizarov, on his near 40 years ago, when he started lengthening, all patients step by step start touch and this patient, because all of them has shortening all segments, tibias, humerus, forearm, femurs, and on 1983 in Munich on the big Germany Congress, Ilizarov introduced first big experience with results of these patients. Chairman Professor Wagner says this is a category of patients and his treatment haven't future, and doctor can help only with correction of deformity. But this was his mistake, because already Carlo Mauri opened name Ilizarov for the world, and many foreign patients come in Kurgan for his dream, for increased height, like this Italian patient, this patient from Germany. And during this 40 years, over 900 patients with achondroplasia have been treated in Ilizarov Center. Biggest group from this patient was 11-12 years old. And when we study X-rays of this patient, we find period of growth to maturity, period of delay, period of equalizing, and period of accelerated maturity, and find optimal age for treatment. All of these patients has indications, but few patients, 3 patients, we find contraindications for surgery. And I want to show this example because all of this surgery was first in the world. Like this patient first consecutive monofocal lengthening of femur 1973. Another first simultaneous monofocal lengthening of femur 1981. And each methods show a way for another methods, because for example, when we to do elongation on the upper part, proximal part of femur, we have expressed periostal reaction. Same situation sometimes we saw on the distal part, and reason was insufficient rigidity not enough fixation with long fragments of bones. And like this patient, after elongation of tibia, we need to spend 2 stages for elongation of 2 femurs. And this example, very interesting example, from handicap, this boy after finished of treatment go to the army. And any army in the world has a very high standard for health. And on the finish of the treatment, this patient has perfect function of joints, can run, jump, and continue normal life. And in other methodics, when we have simultaneous femoral lengthening, this is real, very difficult, not only for patient and for doctor too. And just now we not follow this way. And each wire which passed Professor Shevtsov was Professor Ilizarov was first, consecutive wires insertion to each level with further fixation to support. Wires insertion at level distal third of femur considerate flexion and extension in the knee joint. Attachment of hinges before corticotomy in order to avoid fragments displacement after corticotomy. Because of bone fragments reduction, to placing hinges in initial position after corticotomy. And Professor Ilizarov osteoperforation at corticotomy site, because this is give a chance to do corticotomy more easy. Minimal invasive approach according to Ilizarov. 1 stitch, 1 suture for 1 corticotomy. Maintaining of additional support to tibia to protect knee joint and control hinges. And after that must to be bent knee joint. And bifocal lengthening of femur has best data from all of methodics. And how any methods will have complications, but very important to know how will complications come in. For example, period of distraction, if you know will infection, if you know will contracture or neuropathy, you know reason. And contracture or neuropathy, maybe doctor has recommend very high speed lengthening. And for example, short term, we have some complications because Professor Ilizarov never put on plaster cast after removal of frames. And after complications, we for all of patients recommend for few days, 1-2 weeks, use plaster cast. And these complications just now not repeat again. And with this patient with elongation, not only femur and tibia too, and humerus, any surgery give improvement, and we have more than 90% of excellent result. And each methods coming from in other methods. For example, after elongation of tibia, we need to lengthen femurs, and I show this patient from Iceland, Helgi Oskarsson, because we elongate too much on the proximal part of femur, and he has strong complications, both of hip joint will subluxation, but God help us, and with conservative treatment we fix this problem, and these complications not influence on the final result. And after that, this was maybe last patient. After that, Professor Ilizarov start new technique of cross-lengthening tibia and femur. But during this period, you see, when we to do cross elongation, femur and tibia, we need to think about level of knee joint and amount of centimeters on the tibia will near same like on the femur. We never now to do elongation more than 10 centimeters. And this is not enough for dream, and sometimes patient won't repeat again. Like this patient twice underwent cross-lengthening, and we increased his height near 50 centimeters. This patient was first with bifocal simultaneous lengthening, all of segments tibia. This is Italian patient, humerus, femurs, and he now married on the Czech model. I am happy doctor because took bolted nuts from hand of father of this method. And on the final, I want to show this small house. This is place where magic Ilizarov method was born. Thank you very much for your attention.
Thank you very much for a very nice lecture.